right, welcome back to my channel. My name is Melissa Barron and I am just trying to get comfortable, literally trying to get comfortable. So I always have a hard time talking in front of the camera, but I am trying to get better at it for you guys because yeah, sometimes this is hard, not having a person to talk to, but I'm gonna talk to you guys. All right, so I am going to tell you my top 5 things that you should expect coming out of nursing school in this COVID time for 2020. We're about to be rolling 2021 in a few months, so I'm gonna tell you exactly what to expect and some of the things that I've experienced, and this is how I've learned what to kind of expect after nursing school, after you pass your Nclex, and you know, moving forward to doing other things. So my number one thing is going to be applying for jobs, right? Obviously, you got into nursing because you wanted to get a job. You want a good paying job, you want it in a good area, you want to work at a certain hospital, like you want all this, right? So with that being said, with COVID, some of those dreams may be in the dump, okay? And so I really want you guys to be very open because a lot of the areas that maybe you would have wanted to work in, that area may not be hiring for new nurses out of school. Because of COVID, a lot of the hospital and a lot of areas are not hiring new grads because they want someone more experienced in that area and they don't have the time to really train with all of the amount of patient care that they're having to take care of these days. I know a lot of areas like ER, they normally are not taking new grads, or even in my area, NICU used to hire new grads right out of school. And when COVID happened, they no longer hired new grads out of school, which kind of sucked because a lot of people really wanted that area. A lot of people wanted to work in NICU and they were no longer hiring new grads out of school. So just be mindful that you might not get the area, the hospital, or the job position that you maybe wanted just due to COVID. So be mindful of that when you're looking for a job, just to be open and have an open mind, because you can transition. A lot of those jobs, they'll have you in that position for 6 months. Even if whether it be days or night, they'll have you in that position for 6 months and then you can transition out of that position. So that goes into my next thing for number 2, which is your nursing interviews, right? I'm somebody who I literally suck at answering questions about myself, right? Tell me a time when. I'm like, what? A time when what? Okay. But it's so crazy because I could talk about myself all the time, right? If somebody's talking to me, I'm like, oh yeah, me too, right? But when someone asks me like, tell me about yourself, I suck at that. However, with the nursing interviews, you want to be mindful that your nursing interview might look different than it would have looked prior to COVID, right? Your nursing interview might now be on FaceTime. It might be on WebEx. It might actually be a phone call. You might not even be able to see who your manager is or the person giving you the interview. You might not necessarily need that portfolio that you made in nursing school to provide to the jobs. I know for my position that I got hired in for, I had to do a video interview and answer questions and record my videos of me talking on the, on the phone and answering these questions and sending them a video of doing that. And then I also had to do a FaceTime interview with my supervisor, who is my supervisor, and I had to do a FaceTime interview. So that is one of the things that maybe might be different. You might not have to get all dressed up and go to the hospital, but I would still suggest if you are still doing an interview that you still get dressed up, you still put on your business clothes or whatever that makes you feel like a boss in that setting, because whatever I'm wearing is kind of representation of how I feel, right? I'm feeling very relaxed right now because I got on these very relaxed clothes, but let me put on something snatched, honey. Snatched. I'll be up here walking out strutting, okay? Snatched. Okay? Snatched. So, so that's a good thing. Just be mindful of that. Like whatever you represent on the outside sometimes can be represented you know, in the inside. So, and you have to pull from what's from within when you're talking on the phone or doing these phone interviews or whatever. So that is number 2. Number 3, it's gonna sound weird, right? This literally gonna sound weird. These family, friends, and coworkers calls where they're asking you about their medical issues. Literally, is real. I got my first call. So I got my first call. Somebody calling and asked me, hey, I heard you graduated from nursing school. I heard you're a nurse now. Congratulations. But I got this problem, right? So I literally, like, I heard that before, but it didn't dawn on me until it really happened to me. And I was like, sure. That's crazy. But you guys want to be definitely mindful that you cannot give somebody a medical diagnosis or answer questions that are out of your scope of specialty, and you definitely don't want to do it because you don't want to be liable. Okay, so you don't want to be liable for somebody else's actions. So your best response to their call is, hey, yeah, I think you need to seek a doctor, right? That's your best advice that you can give them. But the calls are real. The pictures and the videos are real because we literally talk about it every day at the job, but it's real. Okay, so that kind of leads me to my 4th thing, which something you can look forward to after graduating nurse school and becoming a nurse, is residency programs, right? Although you might not get the job of your choice or the hospital, but you can. Residency programs are becoming so real, and there are a lot more residency programs that are being created out here for new nurses. And one thing, I am in a residency program, and one of the things that I love about it is that this residency program will walk with me for the first year of being a nurse. They provided me with the necessary skills that I need to start my career as a nurse, and me not to feel like, okay, I got 6 weeks of training and now I'm out here on my own for, you know, after getting a year and a half of training. So yeah, make sure that you guys look into the residency programs for your area. Look at the different contracts, compare them, because a lot of different hospitals have different residency programs. So one may offer something and another may offer something else. So be mindful of that. Some of them are 2 years and some of them are 3 years contracts. They are normally a contract type of position. So mine is a 2-year contract. So just be mindful of that. If you're not looking to be locked into somewhere for 2 years, you plan on moving, look into that as well, because they do have some ways that you can get out of the contract. I'm not quite sure what they are, but you just want to look into your contract, your hospital, in your area, and see if that's a good fit for you. All right, so number 5. Okay, number 5 is just the uncertainty. Okay, coming out of nursing school, you, including myself, just has this sense of uncertainty, right? Whether that be in the area of, you know, where am I going to work? What am I going to do? What kind of patients am I going to be treating? So just be mindful that you are going to be uncertain. You're not going to know everything coming out of nursing school, nor are you expected to, right? You're not expected to know everything coming out of nursing school, because nursing school is such a, or not even nursing school, nursing is such a broad area, right? Nursing just entails so much. So you're not expected to know everything. You are expected to know what you necessarily need to know to keep a patient safe, right? But beyond that, you're not necessarily needing to know every single thing. They're not expecting that of you. You can walk into the hospital and be uncertain, but what you do know how to need to be able to do is to ask questions, the right questions, and know when to ask questions, right? Because what you don't want to do is allow that uncertainty but to live in you, but not be able to ask questions and to do something that can possibly harm you or harm your patient, right? So those are 2 things that you want to keep in mind, that you're going to be uncertain, and that's okay, right? Being uncertain is okay, because you're here. You're still in the learning phase. The first year of nursing is still your learning phase, and everybody knows that when you go into the hospital, which is why most hospitals ask for more than the first year of nursing, right? Because they expect that within the first year, you really don't know as much as you need to know. So you just will be uncertain, even with, you know, where am I going next? Am I going to go back to school? Am I going to be a nurse practitioner? What field am I going to be in? Like, there's so much uncertainty around once you graduate from nursing school, and you think when you're in nursing school, you got it all together and you know where you're going, right? But sometimes that doesn't all put itself back together. Once you graduate, once you get a job, some of that stuff can start to go a different way, and you can get really uncertain. But just know that you can ask questions, ask the right questions, ask the right people. So those are my top 5 things that you need to look forward to when you're graduating nursing school, especially in this COVID time. You know, it is, now that I've started my job, I'm super happy with it. I'm happy to be started. I'm happy to be working as a nurse, and I'm happy to be able to share my experiences with you guys. You guys know that my channel is not just nursing related, so I will be adding some extra stuff in that may be related to lifestyle, fashion, maybe even because I am a single mom and I got pregnant really young, so I maybe will even add in some of that, you know, just growing up, like some learning experiences that I had being a single mom. Now, I will tell you is I am going to try to get a lot more comfortable with this camera, okay? Because, yes, you guys, try to get a lot more comfortable, but also provide you guys with the necessary tools that you need from me. So I will see you guys soon. If you did not subscribe or like this video, please do that before you leave, because hunty, you definitely want to see more of me and I want to see more of you guys. So I will see you soon.